All right, so we're going to start with palpation of the sternoclavicular joint. You can find this by locating the clavicle, which is very prominent in most patients. Then you just palpate along the clavicle to the inside, and you should feel the sternum right in here. That's the manubrium is the top part of it. The end of the clavicle, that's your sternoclavicular joint. You'd be able to test your inferior glide of it if the patient were to raise their arm. And that would be, raise it all the way up, please. That's an inferior glide of it. And then if they were to put it back down and go into arm extension, so bring it backwards, that would be your superior glide, and then a posterior glide for arm flexion if they were to raise it forward, like so. And once again, we're returning back to the clavicle, and if you palpate over towards the end of it, towards your shoulder, you should be able to feel a protrusion right around here. That would be your acromion process. And if you fall off of it, you would be able to find the acromion. So this right here would be your acromioclavicular joint. And if you were to do arm extension, it would be an anterior roll of the acromioclavicular joint. And then if you do an arm extension towards the back, it would be a posterior roll of the acromioclavicular joint. All right, so now we're going to move up into the upper arm area. So we're going to start with finding your head of your humerus. If you just start at the acromion process up here, then drop down, there'll be a little divot right around here. That would be your subacromial space. If you go down past that and push in a little bit, you should feel some pushback, and that would be the head of the humerus. If you are moving along the head of the humerus, you should be able to find up top here, there would be a bump up top, and then a little bit of a groove right there, and then another bump lower. That would be your greater tubercle, your intertubercle groove where your bicep tendon runs through, and then your lesser tubercle in that location. Following the deltoid muscle, if you were to palpate it all the way to the end until you find the very end of it, or the teardrop right around this portion, that would be where you would locate your deltoid tubercle, which is where that attaches. Then moving back up, we're going to be palpating the head of the humerus, and moving in, you would be able to locate, there's a space in between the head of the humerus. If you keep moving in towards the clavicle, you should feel a little pushback. That would be your coracoid process. And that covers all the bony landmarks of the upper arm. All right, so now we're going to be working around the scapula. If you can place your hand onto the back of the patient and just open palpating with your hand, you should be able to feel a groove. In my patient, it's right around here. That would be the spine of your scapula. Right below the spine of the scapula, down here would be your that's your infraspinous fossa. And then above the spine of the scapula is your supraspinous fossa. So infraspinous down here, supraspinous up here. And then if you move more towards along the line of the scapula along the spine, you'll be able to find the end of it right around here. And that would be your medial border of the scapula. And then tracing that all the way down to the bottom, you should be able to move down here where you can find the inferior angle of your scapula. Coming around the outside, if you're palpating, there would be a little bit, you push in a little bit to find the resistance, wait for that pushback. That would be the lateral border of your scapula that will extend all the way out here. Moving back to the top of the scapula, if you will find the most prominent part towards the top, right around here, that would be the superior angle of the scapula. And then if you would please raise your arm. Coming in a little bit, if you were able to find the lateral border of the scapula and palpate around on the inside, and then go in a little bit, you'd be able to find the subscapular fossa, which is the part of the fossa, which is part of the scapula that is attached to the ribs. All right, so moving on to the elbow, we're going to start right here with this protuberance. That's the olecranon process. And then if you palpate right below it, there will be a space right here on your humerus. That would be olecranon fossa. And then if you were to move your arm downwards, you start palpating along the edges. You'll feel two bumps on either side of your arm right here. Those would be the epicondyles of your humerus, and if you were to palpate above them, moving upwards, you'll be able to feel the supracondylar ridges above of the medial and lateral portions of your humerus. Moving back down your wrist, if you're about on the lateral side, you can palpate along the ulna. If you move all the way down to the base of your arm, on the ulnar side, you'll be able to feel this the end of the ulna right here, and then there's a little space right at the end here would be your styloid process of your ulna. Then moving over to the other side, the end of your radius, there's a space right here right at the end of that would be the styloid process of your radius. And then moving up here, we're going to have our patient flex her bicep, and flex, please. All right, and then if you follow the flexed tendons of your bicep, you'll be able to feel them drop off and right here, and that is where your radial, right over here, that is where your radial tuberosity is located. And also, if you were to drop right below the medial epicondyle, your lateral epicondyle of your humerus, you'll be able to feel what is the head of the radius. And then if you were to have your patient pronate and supinate their arm, so rotate your arm back and forth, you'd be able to feel the radial head rotating on the inside there. All right, so now we're at the patient's hand. You're going to be palpating right in the middle of your hand here. You'll be able to feel all the metacarpals. If you were to palpate towards the lower portion, you can see your, but you would be able to feel the head of the metacarpals here. Right along this middle part is the shaft, and the end of it is right over here, and this would be your metacarpal phalangeal joint right here, which would grow into your phalanges down here. But coming back to the metacarpals, if you come to your third metacarpal here in the middle, and you were to palpate it past the head, you'll be able to feel a little space right here. And right below that space, that would be your capitate bone. Moving directly under the capitate, you'll be able to feel another bone. That would be your lunate. Coming back to the capitate, if you move one over towards your thumb, you'll be able to feel your trapezoid. And then if you're following your thumb down here, palpating, and all the way at the base, you'll be able to feel what is your trapezium. Back to the capitate, in order to get there, you once again follow the third metacarpal to the middle and locate it right off of the base, right off the head of your metacarpals. Moving towards your pinky side, you'll be able to feel what is your tricretrum. And then back to the capitate, if you go down one below, you'd be on the lunate. Moving one towards the pinky off of the lunate is your scaphoid. And if you have your patient flip over their hand, you'll be able to feel the hamate up in here again, and then there's a little divot in between the hamate and the pisiform over here, and that would be what is known as your carpal tunnel. And then moving back to your phalanges, we have over here your proximal interphalangeal joint right in this location, and then right here is your distal interphalangeal joint. All right, so now we're going to be palpating the neck of a patient. You're going to start with palpating on the occipital bone, and as you're moving down the occipital bone, you'll feel two large bumps on the back here, and those would be your occipital protuberances. And if you come right below that, that'll be your nuchal line, which is what the nuchal ligaments attach to, which attach to various muscles down below in your upper back and in your neck. Moving further down there, we're going to skip past C1 since there is no spinous process there and move right onto C2. So the first spinous process that you would feel is C2 right up in here. Then you're going to move down to C3, C4, C5, C6. In order to test to see if you're on C6 or not, you would have your patient flex their head backwards. And then if C6 disappeared like it just did, then you would know that that's the correct bone that you would be on. Moving back up to the top, you would be able to palpate on the sides and feel the transverse processes of C1. This might be a little bit tender for your patient, so you need to be careful around there. And you'll be able to feel the transverse processes with C1, C2, C3, C4, C5, and C6.